Hey everybody, it is the last lecture that you guys will have for this Friday. Chapter 11 is perinatal education. So I'm going to go through these slides pretty quickly. The chapter is not difficult. Just make sure you have your chapter, you have your PowerPoints printed out, they are on momentum, and I'm going to go through this really quick so that you guys can get on with studying, get on with your weekend. So let's get started. Chapter 11 starts on page 183. And so we have perinatal education. So the goals for perinatal education are to help the parents. So perinatal is also another term for during pregnancy, or even could be pre-pregnancy education. So we want to take an active role in maintaining their health during the pregnancy and birth, and how we can do that is we can educate them to take the healthy active role. Teach them to learn coping techniques to deal with the pregnancy, deal with childbirth, deal with parenting. All these are different classes that they can take that we can offer our patients and direct them towards the classes they need to take. So providers of education, you have registered nurses. So our primary goal as nurses is educators. We can help with special education, specifically if they are pregnant with multiples, or if they are wanting some breathing relaxation techniques, then we can send them to a Lamaze class. Or a lactation class if they want to breastfeed. So we need to make sure that we're knowledgeable about our adult education, any theory that we have about education, any techniques that we like to use. The main goal for us as educators in nursing is to make sure that we're up to date on the most current practice, and that we have the most current information to give our patients. So the education may be a formal setting, it may be informal, and there's varieties of techniques. They can do webinars, they can come to classes, they can do a series of classes or do one long class. Just depends on what their schedules will allow. So the class participants that you get the most participation from are usually middle-income couples who are older and better educated. The more education they have, the more education they know they need. They also have the money to pay for these classes, or they have the insurance that will pay for them to take certain classes. They take classes for a variety of reasons. They want to make sure that they're informed. They have coping strategies that they try to eliminate all of the unknowns, and that will bring down anxiety, which will bring down their pain receptors and hopefully decrease their pain during labor and delivery. But they do want a greater sense of that self-control, the control of the environment, the control of the situation, and by being educated, they feel like that can be accomplished. Oh, that slide is terrible. I'm sorry about that. I will fix that before I post it. But the certified nurse midwife is the woman that cares for low-risk uncomplicated pregnancies, but also has backup physicians if necessary. Then you have nurse practitioners. They work in the office, they see the patients, but they don't do deliveries. And then you have an OB, obstetrician, that is your doctor. So couples may visit different care providers for different reasons. Sometimes the doctors only see the patients during important visits, whereas the nurse practitioners or certified nurse midwives might see the more routine visits, just blood pressure, urine, making sure everything's fine. But then the doctor might come in for vaginal exams, ultrasounds, things like that. Different childbearing settings. We will educate them about hospitals. So there's birthing suites. That makes it feel like a more home-like atmosphere, but it does feel more like a hospital. There's going to be more interventions. It's going to be more monitoring. They're going to have an IV. They're going to get antibiotics if necessary. So the intervention will be higher. Then you have freestanding birthing centers. So in Knoxville, we have the Lisa Ross Birthing Center, and this is birthing suites at a site off campus of a hospital with certified nurse midwives. A doctor oversees everything, but the certified nurse midwife might be the only thing that will be staffed there during your labor and delivery. There's home birth options, so you can blow up a blow-up pool in your living room or do it in your bathtub, where the certified nurse midwife actually comes to your house and delivers your baby. So couples may visit different birth settings to see what is going to be their best for their choice, but insurance may limit their selection. They might not pay for them to have a home birth or a certified nurse midwife. They might be restricted to a different type of setting due to diagnosis. If they're high risk, you can't have a baby at home in the bathtub. You got to have it in the hospital because there's a high risk and need for intervention. So be aware of the different types of settings There's different choices for childbearing for your support person. So, support person can be either father of the baby, relative, or a friend. You may have a certified doula that comes and she's actually trained to be your support person so that the dad can focus straight on the mom and the doula can take care of relaxing, pain, intervention between the patient and the nurse. And we will have a conversation about doulas, and I have a good story for you guys when we meet back after the test next Friday. Siblings also might be present during birth. Sometimes this is a controversial issue or situation due to age, due to sex. So it just depends really on the preference of the mom and the father, what they decide, and also the maturity of the adolescent. So just again, need to make sure that our patients are well educated, that they get the type of education that they need, and some other types of education that they might want to talk about during classes, like I said earlier, is a breathing relaxation, preparing them for childbirth. Excuse me. So different types of classes, and they might have a preconception class. They could need some genetic counseling due to hereditary disorders or genetic testing that's been done, so they might need some counseling that way. Early pregnancy classes to talk about what to expect. Different types of prenatal exercise classes, childbirth preparation classes, and this could be including different types of breathing relaxation, especially for patients who want a lot of information about epidurals or spinal epidurals, pain medication, going natural. And there's some good classes that your book talks about on, let's see, what page is that? Let's see, childbirth prep classes. Let's see, there was a box that I wanted to show you guys. The education for childbirth starts on page 188 and it goes over through 191. So all different types, making sure that we are well aware of let's see what that says. Being educated is going to alleviate that fear, and by being more educated, the couples tend to have a better outcome or a better overall view of how the situation went. So in your book, it talks about education. It talks about the different types of childbirthing education, the Bradley method, the Lamaze method. So make sure that you're aware of those. There's another education that talks about is sacral pressure. And, if you go over that and just think about sacral pressure, which is at the lower part of your back when you're having contractions, and how you can teach your patient to do that. So it's a really low maintenance intervention. You can actually teach the husband how to do that. So it's on your book on page 190. Make sure you have a good idea of that. Your breathing techniques. So all of this is going to be, your relaxation, your imagery, just read through that section of your class, or of your book, I'm sorry. They also have refresher courses. If you've not had a baby in a while, C-section birth class, and then a vaginal birth after a cesarean class, or that's also known as a VBAC, so vaginal birth after cesarean. There's classes for all that. Breastfeeding, parent and infant classes, postpartum classes, and then there's specialized classes. So you can take a father's class, this little siblings, I mentioned in another PowerPoint, can come through, and then a grandparents can also take a grandparents class. So tons of options for different family members. We talked about education, relaxing, conditioning, preparing themselves for the labor, preparing themselves for pain management, for the delivery, and that's all in your book on the pages that I gave you just a minute ago. And I'm so sorry about these slides. I will have those fixed for you when I post this on your momentum. But you also have the three really main education: the Dick Reed childbirth education. That's to decrease the fear. The Bradley is the husband coach childbirth. It tries to go completely natural, low intervention, no medications. The husband is in charge. And then you have the Lamaze, which is probably the one you remember the most, where it has like the patterned breathing for different stages of labor. Also, there's different types of breathing exercises, relaxation, but the one is about the sacral pressure, which I used a lot on my patients, and it really did seem to make a difference in their pain. The labor partner, we need to make sure that we know what they want to do. So do they want to have an active role, passive role, any cultural differences that are going to make a difference? Sometimes the women are in charge in the room, and the women are asked to, culturally, they sit out in the waiting room for the delivery. So we want to make sure that we support them the best way that we can. Help them to learn how to time their contractions, help them focus, provide comfort measures like the sacral massage, the imagery, if they want music, if they want their lights low, if they want epidural, if they want pain medicine. So, again, we're there to make sure that she has a safe delivery, but also a delivery that's as close as we can get to what she imagined it being. So here's the nursing process. Again, after every chapter, we will apply the nursing process to our care and our education. So read over that in your book. And then the last question here is there. Pause the PowerPoint if you need to, and answer that. Again, I want you to look on your syllabus. My email is lakenb@roanstate.edu. And I would like you to answer the 3 questions at the end of these slides and email me the answers. That is your attendance for Friday's class session. You have to have this into me by the Friday of the test, which is exam 1 is on February 3rd. It's over the first 6 chapters, so study 6, 9, 31, 7, 8, and 11. Your PowerPoints are provided. You have these slides. You have my phone number. You have my email. Please do not hesitate to ask me any questions that you have, and I'll be happy to have any discussions I need to with you over any of the material that is confusing. You can include that in your email, and I will respond to you this weekend. So I hope you guys have a great weekend. Thank you for being flexible and for trying something new, a little bit of a flip learning style, and I will see you guys on February 3rd.